It's hot, the sun is damaging your skin, it's sunscreen time. But now sunscreen companies are in a panic about the U.S. Food and Drug Administration's hints that could mean more required tests and the deaths of tens of thousands of animals. The politics of cruelty-free sunscreen, next on the PETA Podcast with Emil Guillermo. Welcome to the PETA Podcast. I'm Emil Guillermo, your host for this inside look at animal rights. Brought to you by PETA, the largest animal rights organization in the world. On today's episode, thousands of animals have already died for your sunscreen. Is there a need for more animal testing that could mean tens of thousands more dead animals? The U.S. Food and Drug Administration, the FDA, is being coy about it. And now companies are coming to PETA to make sense of the mixed messages. The fact is, no other country is concerned, just the U.S. But instead of coming up with more reliable non-animal methods, the FDA in its cryptic way seems to be leaning on requiring more animal tests. Can you save your skin and save animals too? Jeffrey Brown is a PETA UK science advisor, thinks you can. But the FDA is making things complicated. Brown explains the politics of cruelty-free sunscreen on this edition of the PETA Podcast with Emil Guillermo.
The problem is that the U.S. Food and Drug Administration has suddenly suggested that the requirements for keeping sunscreens on the market are changing. To back that up, this is only happening in the U.S. No other government in the world is saying anything remotely like this. And that's because sunscreens have been on the market for 30, 40 years, sometimes longer. And they've been used by millions of people very safely. But at the moment, what is really the sort of central part of this problem is this question of when the FDA comes in and says something might be changing, companies start to get nervous. And in this case, the FDA has said that there are really two particular kinds of tests that they want to see carried out to keep sunscreens on the market. And they've thus far rejected every proposal to use non-animal methods to sort of meet those requirements. So that's why we're stepping in.
So tell me, you're saying that it's almost like the FDA has hinted to companies that this is going to happen. PETA actually uncovered this idea that something is going to happen. How did you uncover it? And what specifically now is the FDA saying that's making companies sort of, worried?
There's so many angles to this that the simplest way I can put it is that this isn't a secret, right? So FDA started talking about this all the way back in 2019. And what's been happening behind the scenes is that companies that make sunscreen products, they saw this request coming up from the FDA saying, hey, we're thinking about this. We really just want to make sure sunscreens are safe, which is a fair statement. This happens to products on the market all the time. If there's new information that comes up that says, the FDA approved a drug or a product and it's been on the market, but oops, we missed something. Now we think there's a question about the safety. Let's take a look at the data again. So in the beginning, that's what it seemed like what was happening. But that was 2019. By 2024, if we've uncovered anything, it's that companies that make these sunscreens have been coming to us and saying, hey, we've really found a problem here because it seems like the FDA wants us to do these animal studies. It seems like it, but they're not outright saying they require it. What do we do? So the problem is that every time we work with companies like this, we walk them through the process of how to propose a non-animal approach to the FDA, and the FDA just keeps saying no. So it's not the same as FDA requiring animal studies, but sometimes the silence speaks loudest. And by FDA not accepting these non-animal sources of data to answer these questions, it seems like they're choosing to kind of compel companies to make the decision to conduct animal studies on their own. It's a complicated scenario.
Yeah, but now companies don't know what to do. PETA is in on this now to try to see how it can prevent more tests. What kind of tests are we talking about that it looks like the FDA would move toward? I mean, which is really the issue. What kind of tests and how many animals might be involved if there are a new wave of tests?
Yeah, it's not an insignificant amount of animal testing. The testing falls into two big groups. On the one hand, there's reproductive and developmental toxicity testing, and that involves exposing multiple generations of rats to the active ingredients in sunscreen. That includes rats when they're pregnant and baby rats. And the idea is that you do this to thousands of rats, and then some a number of them are run through behavioral tests or cognitive tests. And the idea is that you're looking for signals in rats that in some way would suggest that maybe something would happen to human babies who are in the womb or being or during development that would impact how they learn in later life. The other study set are for carcinogenicity tests, and that's just a fancy way of saying, do the sunscreen ingredients cause cancer? And this is also done in mice and rats. If this were done for sunscreens, the rats would either be given these substances by throat. It's called gavage, where they're sort of forcefully fed these sunscreens, or they'd be applied to shaven skin. They're exposed to this for months, and this happens over the entire lifetime of these animals. So 18 months, 24 months, something like that. And in both cases, all the animals are killed. The numbers of the animals are shocking. If you do both of those kinds of tests for just one chemical, that's a minimum of about 2,200 animals. And when you add up all the different active ingredients in sunscreens, we really quickly get up to numbers like this would be at least 40,000 animals. And that's a very, very minimum statement. So I think you can understand why we're so concerned about this.
So 40,000 animals on these tests, and each company has to do a test? Or does one test comply for all companies? Or each company has to do their own, right?
You're asking the best questions. And you know how you said moments ago that the FDA is sort of creating some confusion here. They're not being very clear on it. So the answer to all the questions you've just asked is no one really knows. We don't know if this would be a one company, one test, or one chemical, one test. This is part of the problem. The FDA is really kind of running away from solving this problem in a constructive way. And that's not just to say that they're not being willing to consider more modern approaches than those kinds of animal studies. It's that no one really knows exactly what this means.
The crazy thing is that sunscreens have been on the market for years, and it does seem to, unless there has been an inordinate amount of, say, bad things that have happened because of sunscreen use, I don't know why you would need to retest. So why is safety suddenly a question now? Has there been something I don't know about or haven't read about?
I agree with you completely. The way this got started was, before the FDA started talking about this in 2019, they conducted a study with a few human volunteers. And what they found was that when you use sunscreen in the way that it says to use it in the instructions on the bottle that you use it, more of it ends up in these patients' bloodstream than was expected. And that's fair to notice. That's cause for study. But what they didn't notice was anything happening that suggested that that was a safety problem, right? So you asked the right question. And I'm an epidemiologist by training. My instinct is to say, let's study this more. Let's look at what this means. What are the implications? My first stop wouldn't be, let's test this in thousands of rats, because those tests that I mentioned for the rats, they're not yes or no tests. The answers that come out of those tests, they fall on a spectrum. They have to be interpreted. There's pretty wide agreement in the field that the results from those tests they're really difficult to interpret. So it's not even clear what the FDA would do with results of these rat and mice studies. Like if there is a signal in those species that says this might be unsafe for rats, we still would have expected to see in millions of humans using these products for decades. We would have seen some sort of signal that says maybe there's a safety problem here.
Yeah. But so if there was an inordinate amount of sunscreen found in the inside the blood of humans, maybe a cause for alarm, but it seems that the FDA could have just said, "Well, we have enough data. We don't need to be alarmed." But it seems that their first thing is to go to this over reliance on animal testing, or to go on a kind of thing that they know has worked or has bought them time, which is let's go to these nebulous animal tests. And unfortunately, it may lead to thousands, tens of thousands of animals dying.
Yeah, and this is a real problem because what it communicates to people who use sunscreens, like me and you, when we use sunscreen, we know it's safe because it's been on the market for a long time. It's got that sort of FDA seal of approval. That does mean something. But what does it mean when the FDA is saying we're asking all these companies to generate all these new animal test results because ... What does that mean here? So FDA has been really struggling with this. They keep saying we want these new tests, but keep using sunscreens. They're safe. So that mixed message, I think, is saying from the FDA exactly what you're saying. And FDA, all throughout this process that started back in 2019, the FDA has been very upfront about what their rights and responsibilities are. They know and they say they have the right to take the time they need to find the information that's required to make the right decision on this. So part of the struggle is that the right decision should involve the opinion of the companies that make these products, scientists who work on these kind of tests. It shouldn't be looking back at tests that we can kind of anticipate aren't going to do a good job answering the question.
So, what is the response from the companies? I mean, they've come to PETA and asked PETA for its advice, but how are the companies in general responding? Are they decrying a sense of overregulation, or what?
I don't think I've spoken to a single sunscreen manufacturer that thinks this is a good idea. I think they feel pressed against the wall and maybe that they've run out of options. We've also, as scientists at PETA, we've been trying to push the FDA to at least acknowledge that this is a problem and acknowledge that it's one that is an opportunity. There's no imminent risk. No one's dying. There doesn't seem to be any indication that people are at risk or that health problems are happening. So, how about we take this as an opportunity to intentionally design an approach to assess how safe sunscreens are for humans in a way that involves everybody? It involves PETA scientists, it involves researchers in the field, the companies making these products, the FDA. That would be the ideal. So, there's no extreme need here for like a radical new science. It's just there needs to be open conversation, and people at the end of the consumer chain, the people who buy these products, I think they have a right to be able to sort of request that from the FDA.
Yeah, what's strange is that, okay, you're saying that the companies and PETA want to get together with the FDA to come up with a new way to determine the safety of this without the need for animal testing. And yet it seems that the FDA is hunkering down, saying, well, it looks like we're probably going to have to require the murder of animals here. We're going to have to require the animal tests, like they have a traditional scientist uh, addiction to animal tests, which may or may not be relevant to anything, to humans.
Yeah, we often think of this in terms of, in a time like this when everybody's using smartphones, really modern technology. It's almost like the FDA has put out this request and we're trying to call them on a smartphone, but they won't answer the call unless we make the call from like an antique rotary phone, you know? And that phone, sure, maybe that works fine. The sound might not be the best. And maybe if we really try hard, we can understand what's being said. But why don't we just use the expertise? There are plenty of people available who can help the FDA learn how to pick up that modern phone, right? Let's get a clearer signal involved in questions like this.
All right. Now, I guess the real fear is if this is happening with sunscreen, is there any implications that it might include other products down the line? Is the FDA setting a kind of precedent here for the companies as far as what should get tested, and if something comes up, how we as a society with an FDA proceed to figure out what's going on?
The question that you just asked is so relevant, and I think it's useful to keep in mind you're not the only one asking it, and it's not just PETA asking. The To take a quick step back, the Food and Drug Administration considers sunscreens to be pharmaceuticals, right? They're in a specific class of pharmaceuticals that we call over-the-counter drugs. In most of the rest of the world, that's not the case. Sunscreens in Europe, for instance, they're cosmetics. And in Europe, there's a cosmetic testing ban that means that you can't use animals to test these products. So there's a very real concern here across borders about what this message means from the FDA, because the European Commission, a government body in Europe, that they've even written to the FDA to say, hang on a minute, FDA, we don't think sunscreens are unsafe. We're happy to keep looking at these questions and look at what the science can tell us in the future. But have you thought through what will happen if the tests that you're asking for come back and have confusing answers? Like, are we really ready for products to come off the market, or for people to be really fearful that they're using products here in Europe that we know are perfectly safe, but the US has said are dangerous? And yeah, of course, that question extends to other products, because the way FDA has approached this problem is not a good way to approach any problem.
So you're saying that Europe has these same products. They're not as concerned. If the FDA does do something with American companies? Well, those American companies also service Europe too. It could be a kind of chaotic uh, situation there for a while.
Yeah, and chaos is not good for business. It's not good for science. It's not good for confidence in the FDA. And to sort of emphasize your point, there are only 16 ingredients in sunscreens. We call them active ingredients. They're the ingredients that actually block ultraviolet light. That's the light that causes cancer. In the rest of the world, Europe included, there are many more active ingredients available to use in sunscreens. Some of them are better. Their safety profiles are better. Their ability to block ultraviolet radiation is better. The FDA hasn't approved a new sunscreen active ingredient since the millennium, right? I think the last one approved was in 1998. And it's not because companies haven't been trying. They've been trying. So the FDA is kind of stuck. This kind of product is really emblematic of some of these problems at the FDA. They're really convinced that there needs to be this sort of old style approach to how drugs are tested for products that, might not be in need of that level of regulation, because these testing requirements seem to be generating a lot of confusing information that's not helping keep people safe.
Yeah. But for now, where are we in terms of the FDA forcing companies to do something? Is it soon, or do the companies have some time to fight it and convince the FDA that there's something better, a non-animal test or some kind of non-animal research that will produce data that would deem these products once again safe?
The FDA isn't really saying. It seems like companies have exhausted all of their real opportunities to get the FDA on board with a non-animal approach. But because we can't really say for sure, we don't know what the FDA is thinking. But faced with that uncertainty, I think companies are starting to ask questions about how do we make sure that products stay on the market? That is their duty. They've got these life-saving sunscreens on the market and they don't want to risk them. So we are definitely approaching the time when, you know, we can't say that FDA is requiring these tests, but I think it's not long before companies break under the pressure of FDA's unwillingness to work on this issue openly.
I mean, because if they are unwilling to come up with something, but just still have this cloud over the current notion of whether or not sunscreens are safe, then companies will have to do something on their own, right? I mean, they're kind of forced to do something. Is that a possible thing?
Exactly. I mean, from my perspective, it looks like the two options. If you are a company that's selling sunscreens in the US, you either conduct the tests that the FDA is hinting at, or you take your products off the market, or you reformulate them in some way. Because one of the weird details here is that I mentioned that there are about 16 active ingredients that you can use in sunscreens in the US. Two of those aren't up for reconsideration. They're already considered safe enough. There's enough data on them that they can stick around, and they are titanium dioxide and zinc oxide. Those are very good sunscreens, but they're also white pigments, like they're basically paint in one way or another. So, what might end up happening, I guess, again, this is sort of one of the worries, is that in a worst case scenario, the only sunscreens that would be available in the US would probably not be very good options for people with darker skin. And that also is one of the angles of this that I think companies are really trying to avoid being pushed into a scenario where it looks like they're prioritizing one segment of the population at the expense of another. And again, this all just goes back to FDA. Why won't you just talk about this openly, bring everybody to the table, and let's approach this in a better way together and figure out how to keep these very avoidable problems from looming large.
Wow, that's interesting, though. I mean, because it's not with sunscreen, it isn't one size fits all. There's gradations of effectiveness, and I guess that would require certain amounts of chemical versus sunscreen that is, say, less prone to help people, or that's less protective. But yeah, I guess you'd have sunscreen for just people who are fair and people who are dark, and but you have that now, right? With the different.
Exactly. And I think a lot of times when people hear sunscreen product, you think of that bottle that you pull out when you go to the pool or the beach. Maybe you use it once or twice per year. But sunscreens are in everything, like they're in makeup, they're in lip balm, they're in hair products. So we're not just talking about a little sampling of what the products that many people use. I imagine that if anybody goes to their medicine cabinet and reads the ingredients on the products that they have, they'll probably be surprised to see these sunscreen active ingredients where they maybe weren't even thinking that they were around. So this is a really wide impact scenario. I also think that because of that, there is this understanding that, from our perspective, the FDA is clearly not wanting to make too much noise about this because I think they found themselves in a really complex situation where they started by asking a genuine question about, let's make sure that this stuff is safe. But they moved it in a direction that now has so many of these side problems and difficult considerations that I can't think of a good and easy way out that doesn't involve them having to just speak up and say, we've been moving too quickly and we need to slow down. Everyone is safe right now, so let's take our time and do this in a more deliberate way.
Well, certainly they don't want to cause an alarm, but they could, considering all the different products that could be involved, they could be on the verge of that. Tell me about the election, since the FDA is a government agency. Would an election have any kind of effect or change on any of this?
Elections always run the risk of changes known or unknown in regulatory agencies. And I also think that as relevant as those questions are, I don't think, because it's not a dependable outcome, it's not a decision that influences what companies feel is the main pressure. So this is another layer of this, lasagna of worries. What if companies start moving down the track and carrying out these animal tests now, but then by the end of the year, there's new pressure at the FDA, policy changes, and then suddenly these testing requirements aren't seen as so essential anymore. What happens then? So again, you're really getting to the core of this. There are just so many parts of this that have been poorly considered that it's causing chaos.
Yeah, Jeff. Since this is an open thing, I hope you come back and tell us what happens. Maybe once we're through with the summer and everyone's used their sunscreen, it won't be an issue anymore. Or maybe it will be a bigger issue. I don't know.
I expect we'll have plenty of updates as the summer goes along. And in the meantime, I think for everybody to take away as a message, PETA's done a lot of the hard work of trying to make sure that you don't have to worry about these things when you're shopping. So check out the Beauty Without Bunnies database. It's at cruelty-free.peta.org. There's also an app. So you can always, if you're shopping for sunscreen, go check out which products are in the database, and you can feel very confident about making a choice that's ethically sound. We'll keep that updated all the time, and we'll come back to you if there's any other update.
Great. Jeff Brown, science advisor for PETA UK and a longtime friend of the podcast. Thank you for being on the PETA Podcast.
Thanks, Emil. Always a pleasure.
Jeffrey Brown, science advisor to PETA UK, on the sunscreen politics of the U.S. FDA that could threaten the lives of tens of thousands of animals. See PETA's list to make sure your sunscreen is on cruelty-free.peta.org. That's cruelty-free.peta.org. And that's our show for today. Thank you for listening. Don't forget to send a link of this show to your friends. Tell them you like the PETA Podcast. Contact us at PETA.org. You can find me on Twitter at Emil Amok, or see my vlog at amok.com, or see my work at ALDEF, the Asian American Legal Defense and Education Fund. That's ALDEF, AALDEF.org/blog. And get this podcast on YouTube at Emil Amok 1. Once again, thank you for listening. Check out all our episodes on your favorite podcast app or on Apple Podcasts, where you can subscribe to as well as rate and review the show. It helps get the word out about the issues you care about. Our music is provided by CarbonWorks. Check them out on YouTube. And join us again next time for more insight into animal rights and the fight for a cruelty-free world on the PETA Podcast. I'm Emil Guillermo.